am Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Does the risk of childbearing increase with increased age? That's the topic for today. Yes, it does. But what is advanced age? What is the age that you should begin to worry from? According to statistics, anything above 35 is a worrisome age, and that's a good age to start thinking seriously about conceiving. What are the complications at this age or beyond this age is that there is a decline in fertility. The quality and quantity of eggs in a woman declines with this age, with advancing age, and it begins from around 35 is what statistics say. It's not just that, ovulatory problems also occur in older women. That's because of hormonal issues or decline in the number of eggs in the ovaries or the quality of eggs in themselves. So these are a few complications that arise with decline in fertility. There is an increased risk of pregnancy complications as well, because it's known that women above 40 have a 50% chance of miscarriage, and that's very correlatable with the quality of eggs, because with advanced age the chromosomal abnormalities increase, so the risk of miscarriages also increases. There are gestational complications at this age or around the age of more than 35. That's because with increased age the complications of hypertension, diabetes or preeclampsia also increase. These complications increase the risk of childbearing for these women. There are issues of genetic disorder as well. With increased age, because of increased chromosomal abnormalities, the risk of Down syndrome also increases. Statistically, it is known that Down syndrome occurs in 1 in 1250 at the age of 25, 1 in 350 at the age of 35, and 1 in 100 women at the age of 40. So you know that with increased age, the risk of Down syndrome also increases. There are delivery complications. With increased age, the risk of going for a C-section are more than a normal delivery. This is because the risk of diabetes, hypertension, preeclampsia increase, and obstetricians don't want to take a risk with the mother or the child. With increased age, there is a risk of fertility treatment working out as well. Because of increased age, the reduced number of eggs in the ovaries give rise to more complications, as in more dosage of medications are required to stimulate this woman to ovulate. So with that comes increased risk of ovarian hyperstimulation, which is a side effect of increased stimulation. So these women who require more medications, if they have responded too well, then they have a risk of OHSS as well. Then there is a risk of multiple pregnancies, because this treatment involves multiple stimulation of eggs, and when these eggs fertilize, when more than one egg fertilizes and embryos are formed, there is a risk of increased multiple pregnancies. Even when IVF is performed and 2 or more embryos are transferred, the risk of multiple pregnancies increases, and with that the risk of childbearing also increases. So it's always better to plan pregnancy under the age of 35. Above the age of 35, it's better to consult an obstetrician or a gynecologist or a fertility specialist as soon as possible to plan pregnancy. To know more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.